This video explains all about skincare. I am joined here by my colleague Siobhan to explain what you need to know.
Our skin. The skin is the largest organ in the body. Skin has three main functions. 1. Protection. The skin protects internal organs such as the liver, kidneys, bones and muscles from injury. The skin also provides a barrier against infection and the harmful rays of the sun. 2. Temperature control. The skin helps to control body temperature. When you are warm, your blood vessels open up as they move towards the surface of your skin. Sweating then helps you to cool down. When you are cold, the body shivers and the blood vessels in the skin get narrowed to keep you warm. 3. Sensation. The nerves in the skin send messages up to the spinal cord to the brain so you can feel pain, touch, pressure and temperature. The structure of the skin is made up of 3 layers: the epidermis, the dermis and the hypodermis. Skin problems after spinal cord injury. The most serious skin problem after spinal cord injury is a pressure injury. A pressure injury is an area of damage to the skin and the tissue below when something presses, slides or rubs against it. In very serious cases, the muscle and the bone can also be damaged. How does pressure cause harm? Normal body weight squashes the tissues in the skin in people who are unable to move to relieve pressure. Before a spinal cord injury, feelings of pressure, pain and discomfort caused you to move and change position very often. However, when you have no feeling below the level of your spinal cord injury, you will not feel pain and discomfort in the same way. Your brain does not get the signals that you need to move. You will not know that an area of your skin is not getting enough blood supply, are too cold, or too hot, or is being bruised. Sitting or lying in the same position for too long causes pressure in areas of your body, in particular on areas where your bones are closer to your skin. This pressure means that tiny blood vessels are not able to supply blood, oxygen and nutrients to the area. When there is no blood flow for a period of time, healthy skin cells start to get damaged and then die. This is the beginning of a pressure injury. What are pressure injuries? Pressure injuries are classified using an international system. They are described according to the 4 stages of severity. Stage 1. A stage 1 pressure injury is a mark on the skin without any broken skin. The skin remains discoloured and does not blanch after touching. In people with white skin, the discoloration is usually red, but in darker skinned people, the colour change is more difficult to see. In this situation, a change in temperature or firmness of the skin might give a clue that a pressure injury has developed. Stage 2. The skin will be broken in a stage 2 pressure injury and a dermis will be visible. It may also present as a blister. Stage 3. In a stage 3 injury, the damage is deeper and the fatty layer of the skin, which is the hypodermis, is affected. Slough, which is yellow or creamy in colour, will need to be removed before healing can take place. Eschar, which is black in colour, or dead tissue, may also be seen. Muscles and bone are not affected. Stage 4. A stage 4 injury affects all layers of the skin, down to the muscle and bone. Slough or eschar may also be present. Skin tolerance is the amount of time you can lie or sit in the same position without causing a stage 1 pressure injury. Skin tolerance is affected by personal factors such as age, skin type, state of health, and time since injury, and by external factors such as type of wheelchair, cushion, and mattress. Why am I at risk of a pressure injury after a spinal cord injury? Anyone who spends a lot of time in bed or in a wheelchair and is unable to move independently is at risk of getting a pressure injury. After a spinal cord injury, the loss of sensation and the ability to move to relieve pressure increases the risk of developing a pressure injury. Other risk factors include weight change, loss or gain, smoking, diabetes, incontinence, infections, age, and past history of pressure injuries. Prevention is the key. Try to avoid getting a pressure injury. There are a number of steps which can be taken to avoid pressure injuries. You can keep your skin in very good condition and prevent long stays on bed rest or in hospital by paying attention to prevention. Remember the skin bundle: skin, surface, keep moving, incontinence, nutrition, and hydration. Skin inspection. Remember, as a result of spinal cord injury, the nerves in your skin cannot send messages to the brain in the same way as before. This is why doing skin checks every day is so important. By checking your skin every day, problems may be noted before they become serious. You should check your whole body at least twice a day, paying special attention to the bony areas. This is best done every morning before you dress and every evening when you undress. How to do a skin check. Checking your skin is your responsibility. If you cannot do it yourself, make sure it's done for you. A clean plastic mirror with a long or short handle may be used to look at areas that are hard to see. Help may be needed to hold the mirror or inspect the skin for you. If you can, feel your skin for raised or hardened areas. Start at the front of your body and check head to toe. Then check all areas on your back. What to look for? Warning signs: colour change, redness on pale skin, or purple, bluish, shiny areas on darker skin. Heat or coolness compared to surrounding skin. Hardness or swelling. Pain or discomfort. Blistering, rashes, scratches, cuts or pimples, breaks to the skin, wounds or skin loss. Note: check your skin more often if you increase your sitting or lying times. Keep moving. Lack of movement reduces blood flow to the skin below the level of the injury. Changing your position is one of the best ways to avoid pressure injuries. Change position regularly, and if you cannot change position yourself, make sure you are turned regularly. Turn or follow a turning schedule at night. Remove pressure on at-risk areas and do regular weight shifts. If you are unable to move yourself in bed, you will need to have your position changed by a carer. Pressure relief is usually recommended every 15 to 30 minutes and held for at least 1 to 2 minutes to ensure blood flow into the vulnerable areas. There is no single recommendation that guarantees you won't get a pressure injury. The more you can move, the better. Pressure relief can be done by 1. Leaning to each side. 2. Leaning forward as far as you can. 3. Use a tilt or reclining features if your wheelchair has these. Or 4. Getting out of your wheelchair onto a bed. Note: do not lift yourself. Lifting yourself off a seat is not recommended. You would need to hold yourself off your seat for 1 to 2 minutes to be helpful, and this will cause shoulder and wrist pain over time. Note: if in a manual wheelchair, you should always remember to put the brakes on your chair and have the wheels facing forward before doing a weight shift. You can relieve pressure in the following ways: leaning to each side. Leaning side to side relieves pressure over one ischium, your sitting bone, at a time. You must lean over far enough to relieve the pressure on your bottom. Make sure you do it for each side every 15 to 30 minutes for 1 to 2 minutes. Leaning forward. Leaning forward relieves pressure over both ischia, which are sitting bones, at the same time. You must lean over far enough to relieve the pressure on your bottom. You don't have to reach out for your toes. Often leaning forward with your elbows on your knees is enough. Use the tilt or the recline feature on your wheelchair. Some manual and power wheelchairs allow you to change position and reduce pressure by tilting and reclining the chair. It is recommended that you spend at least 1 to 2 minutes every 15 to 30 minutes in a tilted or reclined position. Follow a turning schedule. During the night or while you are in bed, follow the turning schedule that was advised during your rehabilitation program. You will usually require a turning schedule, which is moving from side to back to the other side every 2 to 6 hours. You may be able to remain in one position for longer than this if you slowly build up your tolerance to do so. If you are able to lie prone, which is on your tummy, you may stay in that position for longer periods using pillows to support your body. As every injury is different, it is important to get professional advice on how best to lie, turn and use pillows to best suit your needs. Incontinence. Keep your skin clean and dry. Wet skin gets damaged more easily. Wet skin can be caused by sweat, leaking wounds, or bladder or bowel incontinence. If not properly cleaned, these can start to break down the skin. Pat your skin dry instead of rubbing it too hard. If you have incontinence, ask for advice about pads and barrier creams to prevent skin irritation. Other skincare tips. Take care of your feet. Remember to check your feet every morning and every evening with your regular skin checks. Open areas, calluses and toenails, if not cut correctly, can lead to skin injuries. Wash and dry your feet every day, paying special attention to drying between the toes. Cut toenails straight across. Check for ingrown toenails. Ingrown toenails may cause autonomic dysreflexia and infection. Wear the right clothes. Wear clothes that allow air to circulate, such as cotton and other natural fibres. Tight clothes, stockings, belts or shoes can reduce blood supply to the skin. Watch out for thick seams, buttons, zips or pockets on clothes that may cause pressure. Be sure clothes are not too tight. Wear the right shoes. Wear shoes 1 size or 1.5 size bigger than you wore before your spinal cord injury. Bigger shoes are needed because your feet may swell and need more room than before your spinal cord injury. Slowly increase the amount of time you wear new shoes. Be aware of heat sources. Do not smoke in bed or use hot water bottles on areas where you have no sensation. Be careful with hot food, hot drink and containers. Spills can burn. Do not sit too close to a fire or a heater. Use your smartphone. A smartphone can be used to help you with pressure injury prevention and management. It can be used to take photos of areas that are hard to see and to check on how injuries are healing. What should I do if I see signs of a pressure injury? A pressure injury is serious. Do not ignore it. If you are not sure what to do for skin problems, call your doctor, public health nurse, or the National Rehabilitation Liaison nurse immediately and stay off the problem area. Any mark must not be ignored, as it can take several weeks or months in hospital or bed rest in order for the wound to heal. If you have a red mark on your skin, which is purplish on darker skin, do the blanching test. The blanching test. Press finger over a red area for 3 seconds. Lift up your finger. If the area blanches, turns pale, it is not a stage 1 pressure injury. If it stays red, it is stage 1 pressure injury. Even after it has healed, any area that has had a pressure injury is more vulnerable to another pressure injury. Therefore, it is crucial that you take care of your skin after a spinal cord injury and actively predict and try to prevent damage before it occurs. Remember, you can prevent the reddening or darkening area from becoming a pressure injury. You must keep all pressure off the area until the colour returns to normal. Thank you for your time, and I really hope you find this information useful.